Just setting this up. No need for retouch. Au naturel. All right, so this is my first attempt at a YouTube live. I am Dr. Nahim Mizan. Many of you know me, but I am a family medicine physician that now runs my own medical coaching, medical legal advice business called Mizan Coaching LLC. Our contact information is in our profile if you do want to work with us. I highly recommend everyone just talk to us at some point simply because we work for patients, we work for hospitals, clinics, we work for anyone really like that requires some sort of in-depth medical or medical legal advice and tips coming from a physician that has worked in both worlds, the clinical world and the non-clinical world. And the other reason why I'm doing this live is so if you have any questions regarding medicine, if you have questions regarding patient care, and I just woke up, so sorry about that. So, for all of us out there, we're all patients, right? So part of why I run my YouTube channel is simply because I want to teach everyone how to advocate for themselves more, because a lot of the medical legal lawsuits that we that we see and receive are simply due to poor communication from doctors and nurses. That's really what it boils down to. Doctors and nurses are highly trained. It took me 30 years to get to where I am today. However, like many times, physicians and nurses just don't communicate things with their patients. So hopefully, if you can like and subscribe to our channel, that will help us spread the word. Again, our mission is not to make money or anything. Our mission really is to just spread patient advocacy and the very niche field of the medical legal world so that everyone understands this stuff. Um, so, so yeah, if you do have any questions, I'm looking at the chat right now. And if you and if you do have any burning questions that require a full explanation, then our videos, basically we've created a library of over 100 videos that explain how to be a patient advocate. If you have questions about a surgical complication that has been made, our videos again contain. We have a video on what to do if you suspect that your surgery was botched by a surgeon. We have a video on how to file a medical malpractice lawsuit. And again, and sorry about my throat; it's like killing me right now. But really, the point of our channel is to empower patients all across the world. And again, like I'm based in Los Angeles, California, but I know for a fact that medical malpractice happens all over the world, right? So, does anyone else have the flu? By the way, like I had the flu for about like 3 weeks, and it's been horrible. Where can I see the chat, guys? Oh, whoops. All right, you know what? I'm gonna pull up my other account because I like a bunch of people are joining. Hey, good morning, everyone. I look very disheveled, but like it's my one day. It's my one day where I can actually answer questions from the community. So give me 1 second. I really want to see your questions. So. All right, brilliant. All right, awesome. Yeah, so I have it open. So, if you guys do have any questions, I allowed it. So, let me put in everybody. I'm not scared of anything. So there you go. All right. So, so anyone can comment, by the way. So again, for those of you who've just joined, I'm Dr. Nahim Mizan. I'm a family medicine physician that now does medical legal consulting. So I literally just help patients fight the system. And again, like I was on, if you guys have been following my channel since, like 8 months ago, I was on TikTok for A good amount, like about a year. And two things happened. Number one, I suffered severe brain rot. Like TikTok is just really crazy, and it has a lot of good stuff, of course. But like I just felt like I was just going insane, like being on TikTok. And number two, what happened was I became way too for my comfort, I became way too well known. Like, there was I had over I think I had over like 10,000 followers within a week. Like literally, that's how quickly I blew up or became viral. I don't do social media, right? So like my team does all that stuff, but I sometimes do these personal things simply because I think it's always more fair and transparent for a doctor to talk directly. I don't believe in deferring things. The only thing my team does is like technical stuff because I'm only in my 30s, but I hate tech stuff. So yeah. Anyway, so those of you who are joining, ask me any questions you have about medicine, about patient advocacy. I'm a medical legal doctor, so basically most of my clients are just people like you and me. So they're people that have been wronged by the system, that have been, denied insurance claims, that, a doctor did something wrong and they have no idea what to do. Um, you know, like I don't even have to say this, but my family is the most protected family, I think, because of me and like other members of my family that are versed in both medicine and the law. And so, growing up in this environment, I figured like, what am I doing? Like, of course I'm helping my patients. I worked in downtown Los Angeles for a few years. But I really wanted to make this knowledge global. So please, 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 I don't see any questions in the chat, but like this live is really just an introduction. This is my first time doing it, guys. So so please help me out. Like if you do have any advice for how to run a live, um, I had a microphone, but I forgot to attach it. Sorry about that. Next time I'll attach the microphone. But yeah, so basically, just remember step one, and I have a rough outline of what we're going to talk about today. So step one is that you hold the power in the relationship, and I think that's something that a lot of patients just don't realize this, right? Because when you're at the doctor's office, you feel like you're going to some professional's office, and I would just like sit with my patients and just ask them like, yo, like, and I go by a first name basis. So even though, it says Dr. Mizan, like I go by Nahim, like that's my first name. So I tell all my patients, just call me Nahim. We're all the same. We're all, like God. The only thing superior to us is God. Like that's honestly my belief. We're all equal. Um, so I would always go by my first name. So when you're at the doctor's office, number one, I would say make sure that you're speaking with someone competent. So if you came in for like an upper respiratory infection or with chest pain or with a like severe abdominal pain, you need to advocate yourself, because usually what I've seen with a lot of my patients, especially patients that are just more shy, or who have sort of like I don't know, like a propensity to not speak up their minds, is that they don't really talk much. So they don't explain to their physician what exactly is going on with them. So they're just like, oh yeah, I have a stomach pain. And then when the doctor asks, those very strict questions, like they don't really explain like, what exactly is going on. So, when you go to the physician, like you are the boss, all right? Like, no one is not in a malicious way, okay? Don't bully anybody. Like that's not what I'm advocating here, but I think that the pendulum has swung in such a weird direction where patients no longer feel comfortable speaking with their physicians, and physicians as well, like we feel scared now. Like we feel like we can't really be honest anymore because like many people threaten to sue us, or many people can't try to cancel us or something. um so it's become a very strange situation in American like healthcare society. So what I would say is, like just it's a it's a mutual relationship. Make sure that you advocate for yourself, you explain clearly what the issue is, and be both of you have to be grateful, like you and the physician need to be grateful. So that's really the first step in patient advocacy. It's like telling the doctor exactly what you feel is going on, because you know your body the best, right? Like nobody else knows your body except for you. um so other than that, like when something does go wrong, then the first thing you need to do is document. And I have many videos on the importance of documentation. I encourage everyone here to watch those videos. Um, but again, like you don't have to be like and this goes for everybody, by the way. So like my clients and my viewers are everybody. They're not just patients, they're also doctors and nurses and even med mal attorneys. I've actually had a few med mal attorneys reach out to me. So like one thing that I highly advocate for is oh, I don't. Good morning, Anik. I don't speak Hindi. I'm not Indian. I was raised in Los Angeles, but thank you for joining. And yeah, hopefully in the future we can get different translations. Um, anyway, so one thing that really that we notice is that one thing that we notice is that when something goes wrong, patients basically don't tell anybody. So this happened in my family. This happens everywhere. So one thing that you should always do is document things. So if let's say that your father goes to the hospital, tell your dad about or dad, text me when you're at the hospital. Text me the name of the nurse that saw you, that did the triage. Text me the name of the doctor that you're going to see today. Um, and then whatever your the ideal is to go with your father or your grandparents or whomever, but the best thing to do is to document everything that's been going on. And the reason why is because if something bad goes wrong, you have a paper trail. So either text messages, photos, literally like a transcription of like a phone call. Like those would be absolutely the best. Like whenever you file a case. And again, like that step requires that you speak with a personal injury or medical malpractice attorney. What my business does is that we are basically the middle people. So it's like, I just talk to people directly. And I will guide you. So if you ever have a case where you're like, you kind of feel intimidated by talking to an attorney, you can just call me, and I will be able to help you establish a case, and just to make sure that what you're thinking is correct, right? um yeah, so basically that's what we do here. So number one is to advocate for yourself. Number two is to document everything, like absolutely everything you can. And number three is to, and I know this is whatever, but learn as much as you can about medicine, because guess what? Like this is your human body, right? So unlike, my brother, like my family members are, hey, how you doing, Ash? Yeah, good to see you, man. So many people in my family, they're engineers. So it's like, yeah, like they know something amazing, and thanks to them, millions and millions of people are living great lives, right? When you are a doctor, the crazy epiphany that you get during your training is that everyone should know this stuff, right? Like it's like for example, my first car was a Toyota Corolla, and I love that Toyota Corolla. Like I drove it, hundreds of thousands of miles. It was great. Toyota Corolla, superiority, right? So, but like basically, I read the manual. I would watch YouTube videos on it. Brilliant. Thank you, Ash. Yeah, so what's brilliant is that like when I had that Toyota Corolla, I learned all about it. Like I learned all about it. And so with the human body, it's incumbent upon yourself to take care. Number one, to learn. Knowledge is everything, right? So learn as much as you can about your own human body. Every knowledge is free now, right? Like it's like, what's really crazy is that like when I was in medical school and residency, I actually learned the most just on my own. Like I literally just, went on Wikipedia, I went on UpToDate, I went on Hippocrates, and I just learned things on my own. Like, and the reason why is because it's always better to learn things from a primary source. Because in my opinion, like the whole master apprentice system works as well. But the healthcare system as of now is so like it's so hierarchical and it's so specialized that we don't really have this master apprentice system anymore. And so everyone basically knows bits and pieces of medicine. I do as well, right? Like I'm extremely specialized in general medicine and then in medical legal work. That's it. Like I know very little about surgeries. I know very little about, I don't know, like birth injuries or whatever. So, like this is really why doctors this is why it's highly recommended to get this is why it's highly recommended to get second opinions, right? Because, like for example, if you talk to me, you're going to get this perspective based on this, lineage of training. But if you talk to a different physician, you're going to get a totally different, educational model. You're going to get different opinions, you're going to get different advice. So yeah, that would be my next advice. Like, like other than documenting and advocating for yourself, always learn as much as you can about your own human body. And then, once you know those things, like don't assume that you know everything. Like don't be arrogant, right? Like don't try to cancel people. Like it's crazy what's happening now, right? So like I would say, just have a mutual conversation with your physician. Um, and like, because basically you're both trying to do the best. Okay. And we can talk more about like the conspiracies and all that stuff, but like at the end of the day, like physicians are. I do, yeah, yeah. So I'm from Los Angeles, Ash. So if you're in California, you can hit me up. And I do teach, yeah, yeah. So you can contact. My email is in our profile. So if you click on our channel name and then about or profile or whatever, you'll see our email address. It's just mizancoaching@gmail.com. Yeah. Um, Oh, brilliant. Yeah, yeah, yeah. Very nice. Very nice. Yeah. Yeah, well, yeah, I think it's like I have family in India. I'm not Indian myself, Ash, but I have a lot of family in India. But yeah, like email me anytime, Ash, and like I'm totally happy to help you and your friends. Whoever wants to become a physician or a doctor, that's me. Like so I will help you. I will help you guys. Um yeah, anyway. So other than that, so once you advocate for yourself, once you teach yourself, then the best thing for you to do really is to apply that. So, start eating healthier, start working out every day, and then go to your doctor regularly. Like what I mean by that is like at least once a year, to do your annual wellness check. And then when you get your blood values, like when you get your CBC, your CMP, look it up, right? Because again, everything is online. Like, nothing is what's the word? Gate kept or gatekeeping. Like nothing is gate kept anymore, right? Like it's like, like everything is online. You can just learn medicine on your own. Um I'm studying in ninth. Oh wow. Okay. Well, best of luck, Ash. Yeah, you have a long way to go. So yeah, like but I believe in you. Like you'll do very well. Um yeah, so like I'll just chill here. I'm checking out the chat. If you guys do have any questions, just leave it in the chat. I'll answer. But I have a few consults actually that I'm going to be working on. So, but I'll be on. I'll be on like for the next hour or so. So just yeah, like ask any questions you guys might have. But yeah. But yeah, that's who I am. If you have any medical questions, so basically this live stream is for basically it's an introduction. This is my first time doing this. So if you have any medical questions, if you have medical legal questions, if you think that you've been injured or harmed in an unfair way, and also if you are a doctor or a nurse that wants to leave clinical medicine and wants to go into an alternative non-clinical field. Like if, for example, I work from home, right? Like I do consulting. So I work from home. I basically just work on my laptop and my phone. I still do doctor work, right? So and again, this is something that like a lot of people, Los Angeles, man, Ash, yeah, in California, in the United States. Yeah, so this is something that a lot of doctors don't really know about, right? Like they think that, oh, you only have to, you know, that's really good, man. Good job. Keep it up. Keep it up. Yeah. Yeah, but Ash, like I know you want to be a doctor, so ask me some questions, man. Like ask me some medical questions, like ask me what you want to do. Um, oh, you're not doing good. That's okay. That's okay. We all went through that, like um Like I remember when I was in I went to UCLA for college and university, and like I remember like I like when I entered college, like again this is like blast from the past, but like when I entered college I didn't study like at all, because like in high school I was, I was a top student and all that good stuff. And so then I thought like, oh, I don't really need to study or anything, but in actuality, heck yeah, you need to study. Like so it was very humbling for me. So it's like, no one is a genius from nothing, right? Like you have to learn, and you have to put in the time. And once you put in the time and effort, trust me, Ash, like you're gonna do better on studies. And yeah, and that's okay, man. Like, it's, in my opinion, it's okay to have a deadline. All right. And again, like it seems funny, right? Because like then you feel pressured, but when you feel pressured, it actually feels better. Because then it's like, oh, okay, like, I have 1 week until my exam. So, um, that way, like, that, like, okay, like, I have 5 days to like study really hard. Because if you don't have a deadline, then it feels like, oh, well, whatever, I can study like 5 minutes today or something, right? So, yeah. Well, what's the exam on, man? Like you're in the ninth, so like I'm assuming, is it just like general, so like math, science, English? Uh, Yeah, to be honest, man, like I wasn't that great in math either. That's why I became a doctor. Like you don't really need math to be a doctor. Um, but like yeah, like I think can you get a tutor in any way? Like are there like affordable tutors in your area? Uh yeah, that's okay. Yeah, what kind of math? Oh, okay, yeah, you're doing tuition. Yeah, yeah. My wife was in tuition forever. Like, you know, oh, okay. Yeah, that's okay. That's okay, Ash. Like, you got this, like, just focus. Like, the more I like what I learned, again, like I'm in my early 30s, but like what I learned, because I used to be a pretty crazy guy. Like, I did a lot of crazy stuff in high school and then in college and stuff. And like, I still became a doctor, right? So it's like, like my honest advice is time is directly related to success, whatever your definition of success is, right? Like I don't care about money, I don't care about that stuff. Like, yeah, yeah, yeah. No, I get it, man. I get it. Like see, that's exactly what I'm saying. Like it's like, when I was in high school and college, like I just kind of like hung out with my friends all the time, played video games all day long, like, you know. Oh, actually, yeah, my wife speaks Kannada. That's really cool, Audrey. Where are you from? I should like bring my wife in. She might help you more. Yeah, my wife was a doctor in Mumbai, and then she worked in like Bengaluru. Very cool, very cool. So yeah, so like my wife was a doctor in Mumbai, and like she went to a bunch of different cities, and so she learned a little bit of Kannada. But Kannada is really difficult, Audrey. Like it's like, I was very shocked at how different Kannada is from like Hindi, and like I speak Bengali or Bangla. So like, like it's very different from Bangla. It's very different from Urdu. Um, but I mean, I'm sure there are YouTube videos on how to learn Kannada. I don't think Duolingo has it, right? So yeah, my wife also speaks Malayalam. Yeah, so like she's insane. Like my wife's a genius. Like she just, because she traveled all over India, like in order to learn things. So um, and in order to practice. So it was really cool. I've examined, holy moly, 26 chapter. Yeah, you guys get tested a lot. Like I grew up in America. Like I'm from California. Um and like it's like, I feel like yeah, like I feel like our education system, like back then, was okay. But like, now it's like, now we're all realizing that. Yeah, no, no, no. I agree with you, Ash. Like my brother-in-law, he just left India, um, and like he was telling me that, like, now like the education system is really different. So, no, but you guys got this, all right? Like, and if you do want to go into medicine, then my again like Audrey, like my email is in our profile. So you can just email us directly and we can help you guys. So yeah, but usually, like usually I work with like, patients and hospitals, but if you guys have any medical questions, then I'm here for you guys. Um, yeah, but yeah, so any medical legal questions, any medical questions, I'm an open book, like I'm a very honest and transparent doctor. I think in America right now, like, people are just very scared. So they're not really like asking for they're not really like looking for help or improvement, right? Because like everyone's sort of like malicious right now, and there's a lot of like misinformation from every side. Um, but yeah, oh, that's really cool. Your mom, whoa, your mom works in the NICU. That's amazing. Like may God bless her. Like the NICU stands for neonatal intensive care unit. So that's where sick babies go for recovery. So yeah, like then Ash, like you can ask your mom, like how did you study? Because to be a NICU nurse is really difficult. So it's like she had to, yeah, yeah. Oh yeah, yeah, totally, totally, 100%, Audrey. Yes, yeah, yeah. So like the Indian healthcare system is a little bit different than the American healthcare system, but like what I would recommend is like know what your like this is gonna sound kind of funny, but like know what your goal is and then create a path to that goal. Okay. So like right now the two of you have tests coming up, right? So it's like, like the test itself is all you're thinking about. But believe me, you're gonna do fine. And then the next thing is gonna happen, the next thing is gonna happen, the next thing is gonna happen, right? And eventually you're going to be in college, eventually you're going to get married, eventually you're going so it's like don't worry about any of this stuff. Like you're going to do fine. Just again, like Audrey and Ash, like please like spend a lot of time studying. And then like like I'm going to hold these live sessions like pretty often from now on because I enjoy doing them. So just let me know, like let me know what works. You can email me anytime. But yeah, the answer, Audrey, is yes. Like you can still get into medical school, like with an 85. That's totally fine. Yeah. Good man. All right, you got this. All right. So yeah, just you got this. Pretty soon you're gonna be where I am. All right, I believe that. So pretty soon you're gonna be Dr. Adrit, and you're gonna be helping other people very soon. All right, take care, Adrit. Thanks so much, man. We really appreciate it. All right, Audrey, take care. Let me know. All right, let me know how the test goes. You're gonna do awesome. Uh, yeah, Ash, like what's really fun when I was in medical school, I had a teacher just like that. Like, like she would just like go, 100 miles per hour on like one subject. And I think it was neuroscience or neurology or something, but she would just go do, 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 do. And you know what I did? I just stopped listening. Like I just went home and I literally just studied on my own. So, like, I think for you, man, like, you're the type of person that just learns better on their own. So I would say just like crack open the books and just like, just study everything. Like, don't try to catch up because, like, when you try to catch up from like, what your teachers are saying and stuff, it doesn't really make sense, right? Because like you're already good at like A, B, and C, and what you have to work on is like D, E, and F, right? But the teacher doesn't know what you're good at. Only you know what you're good at, right? So yeah, that would be my advice. um just like focus on what you need to work on, and just like starting today, just make a study plan. Okay. So like like you're on YouTube right now, so like like Yeah, like like take time to relax, okay? Like that's what I'm saying. Like don't not like like what the worst advice that like I think our parents gave us is like, oh, you can't play video games, you can't watch TV, blah blah blah. Come on, like it's like no, you need to balance everything, right? And what's funny is like my name Mizan. Mizan means balance, right? So like have Mizan in your life. Like just like work hard and play hard. So like study for like the next like 2 hours and then go take a 1 hour break. Like that's what works for me. Yeah. All right, so it's 9 o'clock. I'm gonna end this live stream, but it was great talking with everyone. And I'll be doing these live streams from time to time. So yeah, take care everyone. All right, bye.